Hi everyone. So for this topic, we will be discussing about chemotherapeutic drugs. These drugs are drugs for cancer. But before that, i-discuss muna natin very briefly ano ba yung cancer. Ang cancer ay i-discuss nyo talaga as um, a topic no, sa inyong higher years sa medical surgical nursing. But cancer is actually a class of disease wherein yung cells ng katawan natin nagdi-display ng number one, may uncontrolled growth. Itong uncontrolled growth na ito, merong abnormal proliferation ng cells. Pangalawa, because of the uncontrolled growth, nai-invade niya yung mga adjacent tissues at nadidestroy din niya even the healthy cells. At pangatlo, nagkakaroon ng metastasis, which means nagkakaroon ng spreading sa other locations in the body, usually lymph or blood. Now, obviously, because the cells become abnormal, hindi siya nagiging functional at nagiging fatal siya for the person. Maraming klase ng cancers, and these are classified usually by the type of cell that the tumor resembles and therefore presumed to be the origin of the tumor. So, for example, carcinoma. Carcinoma cancer is derived from epithelial cells. The epithelial tissues. Pag sinabing epithelial tissues, usually these are the cells that line the body parts. They cover body parts. Pag naman sarcoma, from connective tissues. So they connect body parts. And lymphoma at leukemia, sila naman yung mga cancer cells derived from the hematopoietic system. Sila yung mga blood-forming cells. And the germ cell tumor, sila naman yung cancer derived from the pluripotent cells or what we usually know as the stem cells. They give rise, capable of giving rise to several different types of cells. And yung blastoma, ito naman yung cancer derived from immature precursor or embryonic tissue na usually intrauterine life pa lang nagfo-form na siya. Now, ang cancer maraming causes. It could be genetics. Before, cancer is known to be genetic in origin, pero ngayon, you could be the first in the family to develop cancer kasi may mga environmental causes ang cancer. Isa dyan yung tobacco, vices, unhealthy diet. Many of the foods that we eat may contain carcinogens, different kinds of infections. Radiation could be radiation from the sun, no? Or yung mga radiation coming from X-ray machines, for example. Stress. There could also be lack of physical activity and the environmental pollutants, for example, poor air quality. Now, regardless of the type of cancer, may mga general management. And usually, it's a combination of three things. Una, chemotherapy, which is what we will be discussing now. Pangalawa, radiation therapy. At pangatlo, surgery. So, sa radiation therapy, ito yung merong pagbibigay ng radioactive substances doon sa patient. Yung radioactive substance could be implanted on the tumor and that will kill the cancer cell. Yun yung internal radiation. Pero meron ding mga radioactive waves. For example, external radiation siya na kung saan meron lang machine na itinututok dun sa body part to actually kill the cancer cell. Pag naman surgery, tinatanggal yung cancer cell, yung tumor, or yung mismong organ, or even the adjacent tissues. And again, as what I've said, it's a combination of the chemotherapy, kasama yung mga gamot. And there could also be palliative care. Yung palliative care, ito yung just relieving the suffering of the person by improving the quality of life, making the most out of what remains. Usually, para ito sa mga life-threatening illnesses or end-stage diseases na parang cancer. And lastly, pwede rin yung alternative treatment. It could be herbal therapies, dietary regimens, mind-body interventions, parang yoga, meditation, acupuncture, massage, among others. But then again, as what I've said, we focus now on giving chemotherapy drugs. Pag sinabing chemotherapy, chemo from chemical, you use or you give very strong chemicals that will kill the cancer cells. Mahirap patayin ang cancer cells, mainly because mabilis ang kanyang spread at mabilis din yung kanyang proliferation. But chemotherapy, using these strong chemicals to cancer cells, may be non-selective. Pag sinabing non-selective, yes, they may kill the cancer cell, pero kaya din niya, hindi niya kayang mapili yung cancer cell alone. Kung napatay niya yung cancer cell, most probably, meron din siyang mga healthy cells na maaapektuhan. Chemotherapy also has several side effects, but most often, temporary ang mga side effects na ito. Most common route is through the vein, intravenous, given by special doctors or nurses na kailangan trained to give chemotherapy drugs. Chemotherapy drugs can also cause multi-drug resistance. And also, ang chemotherapy ay combination, no? Binibigay usually in combination with one another para maging mas effective yung effect niya. Now, these are the general adverse reactions to chemotherapy. And knowing this is very important para yung nurses maalagaan ng maayos yung mga patient na nag-undergo ng chemotherapy. First is bone marrow suppression. Chemotherapy drugs causes bone marrow suppression, and bone marrow produces RBC, WBC, and platelet. Therefore, nagkakaroon ng mababang RBC, mababang WBC, at mababang platelet during a chemotherapy. Ano ang significance nito? Ibig sabihin, low RBC count, the patient undergoing chemotherapy might be at risk for anemia. Or, maaaring magkaroon siya ng low hemoglobin, therefore magkaroon ng low oxygen carrying capacity. Baka merong mga episodes na meron siyang shortness of breath. Low WBC. WBC are cells important for inflammation, immunity. So kung mababa yung WBC, mataas yung risk na siya ay may mababang immune system. So, mataas yung risk na mabilis siyang mahawa sa infection. That's why during chemotherapy, kailangan well-protected yung patient. They should be wearing masks when they go out outside the house or even inside the house. No, i-protect dapat yung immune system para hindi sila mahahawa ng mabilis because mababa nga yung kanilang resistance against infection. Low platelet count, ibig sabihin meron silang increased risk for bleeding. That's why dapat i-prevent yung mga activities na maaaring mabilis siyang magkakaroon ng pagdurugo. Brushing the teeth may cause easy bleeding sa gums, lalo na sa mucous membrane. Napakanipis lang ng ating mucous membranes dyan. That's why we should teach patients undergoing chemotherapy to use soft-bristled toothbrush. Ano pa? Yung mga lalaki na araw-araw nag-shave. So, kailangan sila ay tinuturuan na gumamit na lang ng electric razor para ma-prevent yung increased risk of bleeding nila, lalo na pag sila ay naggagamit lang ng manual na pang-shave. Another are effects sa GI system. Chemotherapy can cause a lot of gastrointestinal disturbances such as anorexia, nausea, and vomiting. Dahil dito, maaari silang bigyan ng gamot para ma-prevent yung pagsusuka, such as antiemetics, which we will discuss further doon sa gastrointestinal drugs. Diarrhea could also be a problem. And ibig sabihin, so may anorexia, may nausea, vomiting, posibleng may diarrhea. So we are trying to check always problems associated with fluid and electrolyte. And lastly, mucositis. So mabilis silang magkaroon ng mga inflammation, mga singaw, no? Mucositis kasi sa ating katawan, mga pinakamaninipis na mucous membrane, no, ay nandiyan sa ating oral cavity. Ang chemotherapy drugs can kill the cancer cells. So what more yung mga cells ng ating katawan na maninipis lang. So one of which is mucositis, or the membranes of the oral cavity. Kaya nga importante yung pagtuturo ng paggamit ng soft bristled toothbrush. Another sa mga maninipis na cells natin na madaling mamatay because of cancer chemotherapy are the cells, no, of yung hair. That's why alopecia can occur. Nagkakaroon sila ng pagkakalbo during the chemotherapy cycle. But then again, all these are temporary, which means pagkatapos ng cycle ng chemotherapy, maaaring tumubo ulit yung buhok. All these may also include infertility. So during the time na nagki-chemotherapy sila, meron ding difficulty to conceive a child. Ngayon, again, as what I've said, these adverse reactions are temporary, depending on the cycle of the chemotherapy. Minsan, may mga chemotherapy cycles na it occurs one cycle for this month, and then next cycle, another month. So, kung halimbawa, 3 cycles yung chemotherapy niya, tuloy-tuloy, doon niya pwedeng ma-experience yung mga adverse effects. But after the cycle, babalik naman lahat mawawala yung mga temporary adverse effects. Now, these are the different phases of cell division, the normal cell division. Mitosis, nag-divide yung nucleus, cytokinesis, nag-divide yung cytoplasm, so yung G1, including the chromosomes, S, na-duplicate na yung chromosomes, and G2, double-checking. So, recalling the biology class, no? And then the G0 is the cell cycle arrest. The cancer cells still follow the usual phases of cell division. Pero sa kanila, very proliferative. Masyadong mabilis at abnormal yung pag-replicate. Kaya nga kaya niyang ma-invade even the adjacent tissues and the other surrounding organs. The drugs, that's why chemotherapy drugs are combined, is because mas effective yung pag-kill dun sa cancer cell depending on the cycle kung nasa saan na yung division ng cancer cell na yon. So, first group of cancer cells are the cell cycle specific drugs. Ibig sabihin, ito yung mga ito yung chemotherapy drugs na effective lang sa ganitong phase. So, early phase of cell division, or middle phase or late phase of cell division. And the CCNS drugs naman are those drugs na cell cycle non-specific, which means They are effective on almost all of the phases regardless kung nasa saan doon yung phase ng cell division ng cancer cell. Kaya as we go along the different chemotherapy drugs, we will be able to see na may mga gamot na cell cycle specific at cell cycle non-specific. These now are the different chemotherapy drugs. We will discuss 14 types. Please take note that the first 6 chemo drugs are traditional chemotherapy drugs, which means itong mga gamot na ito ay effective sa maraming klase ng cancer cells. Alkylating, antimetabolites, anti-tumor antibiotics, mitotic inhibitors, liposomal chemotherapy, and hormonal agents. Now, yung number 7, which is biotherapy, yung number 13, which is colony-stimulating factor, at yung number 14, keratinocyte growth factor, are the ones we call biotherapy or biologic response modifiers, the BRMs. They do not kill cancer cells, but they augment the natural ability of our immune system to kill cancer cells. Because reviewing the physiology of blood, specifically the white blood cells, meron tayong mga white blood cells that are capable of killing cancer cells. So, ang mga gamot na ito na tinatawag na BRMs or biotherapy will improve the immune cells to kill cancer cells. And lastly, yung number 8 to number 12, the topoisomerase inhibitor, the tyrosine kinase inhibitor, the proteasome inhibitors, multikinase inhibitors, and angiogenesis inhibitors, they are the targeted therapies. Pag sinabing targeted therapies, ang mga gamot na ito ay specific na nakakagamot ng isa or dalawang klaseng cancer cells lang or cancer cell type. Unlike the traditional, marami, general, pero pag targeted therapy, specific siya, mas effective sa isa or dalawang klase ng cancer. Targeted therapies is very important to avoid coffee when taking these drugs because targeted therapies usually cause hand and foot reaction. Namumula, nangangati, namamaga yung kamay at paa as an effect of the drug plus taking coffee. Now, let's start with the alkylating agents. The alkylating agents, they prevent cancer cells from dividing because they cause cross-linking of the DNA strands. Therefore, nagkakaroon ng pag-break doon sa DNA strand o pag-prepare as the cancer cells divide. CCNS category siya, pero pinaka-effective sa G0. Again, I mentioned that alkylating is a traditional chemotherapy drug. That's why if you look at the indications, marami siyang pwede na effective against. Leukemia, lymphoma, myeloma are all types of cancers of the blood. And also breast cancer, ovarian cancer, uterine cancer, reproductive cancers. And then lung cancer, bladder cancer, and stomach cancer. These are the alkylating agents. And among the nitrogen mustards, cyclophosphamide and nitrogen mustard ang most common. Alkyl sulfonates, busulfan, sa alkylating-like drugs, cisplatin, and the nitrosoureas, the lomustine, carmustine, and streptozin. Now, among all of these drugs, especially yung cyclophosphamide, it's important that we teach patients to increase the fluid intake, 2 to 3 liters per day, para mabilis ang excretion ng gamot at ma-prevent din yung pagkakaroon ng urinary calculi. The second group of traditional drugs are the antimetabolites. From the name of the drug classification itself, they disrupt the metabolic processes, therefore inhibit the enzyme synthesis. So, nape-prevent yung replication ng cancer cell. CCS group siya and very effective sa S phase. Again, traditional chemotherapy drug siya, kaya marami ulit effective against leukemia, breast cancer. When you say head cancer, that would involve yung mga cancer ng sa muka, no? Could be oral cancer, neck cancer, lung cancer, another, osteosarcoma, cancer of the bone, and non-Hodgkin's lymphoma. Again, itong mga cancer na ito, mas i-discuss pa ninyo when you take up medical surgical nursing in your higher years. Ito ngayon yung mga antimetabolites. One of the most famous antimetabolites is a folic acid antagonist methotrexate. Ang methotrexate, at high doses, it can kill cancer cells. At lower doses, magaling siya para sa inflammatory action or anti-inflammatory. Kaya nga pwede siyang ibigay hindi lang sa cancer but also inflammatory diseases such as rheumatoid arthritis. Now, because methotrexate is a folic acid antagonist, hindi siya pwedeng ibigay sa buntis na may cancer na nag-undergo ng chemotherapy because folic acid is important para sa formation ng brain and spinal cord ng fetus. Another common antimetabolite is a pyrimidine analog, and that's 5-FU. Okay? Another common is a purine analog, yung thioguanine, and hydroxyurea. It's a ribonucleic reductase inhibitor, all of which are antimetabolites. Another is an anti-tumor antibiotic. Now, it's an antibiotic. Okay? It inhibits protein and RNA synthesis and binds DNA. Kaya nagkakaroon ng fragmentation yung mga cancer cells. CNS group siya, pero very effective kapag G2 phase. Again, traditional, so maraming cancer, leukemia, lymphoma, and the solid tumors such as breast cancer, ovarian, lung, and bladder cancer. Now, it's an antibiotic. So if you remember sa ating anti-infective drugs, no, antibiotic ito, very strong antibiotic drugs that can kill cancer cells such as bleomycin, doxorubicin, dactinomycin, daunorubicin, and the like. Now, when we give these anti-tumor antibiotics for cancer, we watch out for the cardiovascular and the respiratory system of the patient. I-check natin ang shortness of breath, kung nagkakaroon ng palpitations. I-check natin most often yung ECG because it can cause ito yung mga adverse effects lalo na ng doxorubicin. Kailangan i-report ng patient at maaaring ihinto o palitan yung kanyang chemotherapy drug. Again, hindi kailangang mag-restrict ng fluid, hindi kailangan ng fluid restriction, hence, increase the fluid intake. Again, antibiotic siya, binibigay ng IV. Usually, halos lahat ng chemotherapy drugs ay binibigay via infusion. But, if the patient feels there is already burning and pain at the incision site, we have to stop the infusion. And always, that's why always check and assess uh, the IV habang nagra-run yung gamot. Another is a mitotic inhibitor. So, isa siyang plant alkaloid, other compounds derived from natural products, and CCS siya, which blocks cell division during the M phase. Mitotic inhibitors are vinblastine, vincristine, paclitaxel, and the others mentioned here. Sa mitotic inhibitor, from the word mitotic inhibitor, it inhibits mitosis. Ngayon, isa naman sa nursing responsibility kapag merong patient na nagtitake ng ganitong chemotherapy drug is to always check for the peripheral nerve damage. Papansinin kung ang patient or tatanungin kung ang patient ay may mga nararamdamang tingling sensations, numbness, para silang pinupulikat either sa kamay or sa paa. It may cause reversible or irreversible neurotoxicity. Kaya minsan, mas importante na sila rin ay nagtitake ng foods rich in vitamin B12 or the vitamin B12 itself na supplement. Pero pag may ganon, tinuturo sa patient, sasabihin agad pag nararamdaman yon. Another is liposomal chemotherapy. Kung papansinin ninyo ang mga gamot na ito, doxorubicin, daunorubicin, and vincristine, sila din yung mga anti-tumor antibiotics. Ngayon, bakit siya tinawag na liposomal chemotherapy? Sila rin yun, the anti-tumor antibiotics, pero they are packaged inside synthetic flat globules called liposomes. So, ang advantage nito, dahil nga nakabalot sila sa fat globules, these drugs remain in the system longer. Mas nagiging effective kasi nag-i-increase yung duration ng therapeutic effect niya in terms of killing the cancer cell. Plus, decrease yung side effect kapag nakabalot sa fat globules yung mga anti-tumor antibiotics. So, mas mahal siya. The sixth drug are the hormonal agents. Corticosteroids, sex hormones, anti-androgens, and aromatase inhibitors. Ang corticosteroids or steroids, they suppress the inflammatory process, mga anti-inflammatory drugs. And as a result, kung may tumor growth, the slowing or the suppression of the inflammatory process will also slow down the growth fraction of the tumor. Kaya nire-retard yung growth or yung abnormal proliferation ng cancer cell. May effect siya. Ibig sabihin, it's best na kino-combine ito with the other chemotherapy drugs such as prednisone, dexamethasone, hydrocortisone. Another of the hormonal agents are the sex hormones. The sex hormone slows the growth of the hormone-dependent tumor. Ano ang mga cancer na effective ito? Yung mga reproductive cancers such as prostate and breast cancer. Example, giving of estrogen. Yung diethylstilbestrol. Giving of progesterone, yun yung medroxyprogesterone acetate or DMPA. And sa androgen naman, ito yung tamoxifen. So again, ang mga hormones na ito, they can slow the growth of the hormone-dependent tumor. When giving these drugs, lalo na yung estrogen sa babae, yung DES or the diethylstilbestrol, always watch out for weight gain, experience nung vascular problems, sodium and water retention, even yung pag-monitor ng blood electrolytes, and of course, sa babae, Watch out din yung kanyang menstruation or menstrual flow. The third hormonal agents are the anti-androgens. The anti-androgens are useful in treating men, again with, of course, reproductive cancer, pero best siya for metastatic prostate cancer. It binds to androgen receptor and it blocks the effect of the hydrotestosterone, especially dun sa prostate cancer cells, because these, again, are hormone-dependent tumors. So, flutamide, nilutamide, and bicalutamide. And lastly, of the hormonal agents are the aromatase inhibitor. They block peripheral conversion of androgen to estrogen. Kanino naman ito very effective? To those na may mga cancer, especially in postmenopausal women, because it suppresses the synthesis of estrogen and progesterone. Therefore, it will slow down the tumor growth. The seventh group of chemo drugs are the biotherapy agents. These drugs do not kill cancer cells. Again, what do they do? Sila ay nag-augment ng natural ability ng ating immune system to kill cancer. One of which are the cytokines, interferon, interleukin, and TNF. Meron tayong mga ganito sa ating katawan, naturally occurring, but these drugs are synthetically produced as protein, no, in cells to mediate immunity and send chemical signals. Therefore, yung inflammation, hematopoiesis, nagpo-provide ng antiviral, lalo na yung anti-proliferative para hindi magkaroon ng abnormal reproduction of cancer cells, as well as it modulates the immune system para makombat ang cancer. Again, ito ay genetically engineered. Usually, galing siya sa E. coli bacteria, which contains DNA na nagko-code for human protein. The second type of biotherapy agents are monoclonal antibodies. Ang ini-inject sa patient, antibody na. That's why this is a very expensive drug. Kasi again, ginawa siya under laboratory conditions. These are agents that recognize protein on specific cancer cells. So, nabablock yung growth ng tumor at na-alert yung immune system to attack the cancer cells. Kasi antibody na mismo yung in-inject dun sa patient. Monoclonal antibodies are very effective for breast cancer. Pero magaling siya, syempre, if you detect cancer at the early stage. The third type of biotherapy agents are actually vaccines. These vaccines are effective para sa mga cancer believed to cause by viruses, one of which is liver cancer. Liver cancer may be caused by the hepatitis B virus. So, having hepatitis B vaccine will prevent liver cancer. Another is cervical cancer among women. Yung cervical cancer, it's caused, usually caused by quadrivalent human papilloma virus or the HPV. Recombinant vaccine siya of different types of HPV. Type 6, type 11, type 16, type 18. Ngayon, ang mga vaccines, they come usually in many dosages. And usually, 3 dosages of IM injection para makomplete both itong Hep B vaccine and cervical cancer. Ngayon, sa cervical cancer, ito yung pinakabago sa mga vaccines ngayon against cancer. The most effective age to prevent or to receive this vaccine is for young children, females, age 9 to 11 years old. But according to studies also, even if you are more than 11 years old, even if you are 30, 40, 50 years old, having the vaccine, complete dosages, is still beneficial than having none at all. Ngayon, when taking these vaccines, no, or I mean, when taking these biotherapy agents, like interferon, interleukin, TNF to be specific, yung mga cytokines na yan, when patients receive them, please teach them that it's a common side effect that they might feel flu-like symptoms initially, but will resolve later on. Pero dapat mabilis lang siyang mawawala, hindi siya magtutuloy-tuloy. Another is topoisomerase inhibitor. Now, from this moment on hanggang yung susunod natin na mga chemotherapy drugs, ito na yung sinasabi ko kanina na targeted chemotherapies. Ibig sabihin, these drugs are specially designed or engineered specific for a specific type of cancer. Unlike yung kaninang targeted, ang daming klase ng mga cancer cells na pwede siya or nagiging effective. Kaya nga kanina sabi ko, ang chemotherapy is best if you give them in combination. Now, topoisomerase inhibitors are nuclear enzymes which alter the shape of the DNA. Kaya, pag na-alter yun, nagkakaroon ng problem si cancer cell dun sa pag-replicate at pag-repair niya. Merong topoisomerase 1 and topoisomerase 2. So, si topoisomerase 1 is S-phase. Topotecan is specific for lung and ovarian cancer. Irinotecan is for colorectal cancer. That's why I mentioned kanina, pang isa or dalawang klaseng cancer lang sila. Yung topoisomerase 2 naman, G2 and S, etoposide is for lung and testicular cancer. Teniposide is for leukemia. Another is tyrosine kinase inhibitor. The protein tyrosine is a family of proteins that is responsible for growth, proliferation, and angiogenesis of our cells. When you say angiogenesis, the formation of new cells. If you inhibit them, therefore, binablock mo din yung growth, proliferation, and angiogenesis. That's why tyrosine kinase inhibitors act on tumor and tumor vasculature. Kasi nabablock niya yung activity ng protein na tyrosine at critical yon para sa growth and progression ng tumor. Erlotinib is for lung cancer, gefitinib is for lung cancer also, imatinib is for leukemia and GI cancer. Okay? Another is proteasome inhibitors. In this case, there is intracellular multi-enzyme complexes. They degrade the proteins that eliminate the cells of the proteins. Therefore, kung wala yung mga yun, nadidisrupt yung cellular synthesis. Walang transcription, walang adhesion, walang progression, walang mitosis, therefore walang proliferation. And this is very effective for blood cancer, okay, myeloma, lymphoma. Next is multikinase inhibitor. Because multiple pathways may be used for tumor angiogenesis, blockage of more than one pathway is thought to be more effective. So ano to mga gamot na ito? Sorafenib, sunitinib, temsirolimus. Now, toxicities can be resolved in a few days of stopping the drug. That's why, ibig sabihin, may mga risk ito ng toxicity kasi nga multiple pathway ang inaapektuhan ng gamot na ito. Although side effects are predictable at pwede naman siyang ma-manage. That's why pag nagtitake ka ng gamot na ito, kailangan tama at kompleto ang pag-check ng laboratory tests. Mga blood tests, blood chemistry tests, so laging minomonitor. At walang nakalagay dyan na specific cancer because effective siya for many cancers because of being a multi-pathway process for tumor angiogenesis. Now, angiogenesis inhibitor, from the name of the drug itself, inhibits angiogenesis or formation or pag-generate ng new cancer cells. So, new capillary formation, new blood vessel, so may panibagong magsusupply ng blood doon sa cancer cell. Therefore, if you inhibit angiogenesis, nai-inhibit yung formation ng blood vessel na kailangan ng cancer cell para mag-grow, mag-metastasize, mag-proliferate, etc. Effective ito for metastasis. Kasi nga, kailangan ng cancer cells yung blood vessel din para ma-invade niya yung surrounding organs. So effective ang gamot na ito pag may metastasis na, no? So for especially for GI cancer. Adverse effect ng angiogenesis inhibitor, hypertension, so check the BP. And again, yung mga stomatitis, mucositis, which I mentioned kanina, yung general adverse effects ng chemotherapy drugs. Now, 13 is colony-stimulating factor. Again, ang mga gamot na ito ay hindi cancer-killing drugs. Ang mga gamot na ito ay effective para doon sa adverse effects ng chemotherapy drug. This is manufactured through recombinant DNA techniques. Again, not directly tumoricidal, but number one, diba ang sabi natin, all chemotherapy drugs, because they are strong chemicals that kill cancer cell, they causes bone marrow suppression, which means isa sa mga bumababa ang WBC. At isa sa mga WBC ang neutrophils. Neutrophils, yan yung first line of defense natin sa lahat ng ating white blood cell. Pag may injury, pag may infection, neutrophils ang unang-unang pumupunta sa site of injury for inflammatory process and can start healing process. At kung meron kang mababang neutrophils or neutropenia, ang mga patient na nagki-chemotherapy very at risk for infection. And CSF can decrease neutropenia. Pangalawa, ang ginagawa ng mga CSF, ini-improve yung delivery ng chemotherapy drug because they permit delivery of higher doses of drug. Pangatlo, they reduce bone marrow recovery time, especially after bone marrow transplant na okay for the hematopoietic cancers. Pang-apat, which is in addition to number 1, na pag-decrease ng length ng neutropenia, macrophages, isa ulit siya sa mga type ng ating white blood cell, ganoon din ang granulocytes, mga white blood cells yan, they enhance the ability of the immune system. So, nape-prevent ulit yung risk for infection. Nag-i-improve yung kanilang immune system. And lastly, the CSF also prevents severe thrombocytopenia, pagbaba ng platelet count. That's why nape-prevent din yung kanilang risk for bleeding. So what are they? Epoetin alpha is an erythrocyte stimulating agent, which means that erythrocyte or this drug will improve the RBC. Kasi chemotherapy drugs decrease bone marrow suppression including red blood cell. So yung pagbaba ng RBC. Another is yung granulocyte colony-stimulating factor. Filgrastim and pegfilgrastim, they improve the granulocytes. Ang mga granulocytes, yan yung basophils, eosinophils, and neutrophils. So, mga white blood cells. Pag nag-increase yung mga yan through the granulocyte colony-stimulating factors, nag-i-improve ang immune system ng taong nagki-chemotherapy. Another is sargramostin. Ang sargramostin, bukod sa granulocyte, macrophage. Macrophages are also white blood cells. Sila yung mga mature monocytes. And they are very effective for chronic infection. Ang granulocytes, lalo na yung neutrophils, effective yan for acute infections naman. Ang sargramostin, bukod sa granulocyte macrophage, it can also improve platelet, kamukha ng oprelvicin, which is a thrombopoietic growth factor. So, ang gamot naman na ito, nag-i-increase ng platelet count, lalo na kapag meron ng platelet deficiency because of chemotherapy drugs as an adverse effect. So, ito, nape-prevent naman yung bleeding tendencies. And lastly, the same with the previous item or the previous drugs, ang keratinocyte growth factor naman is palifermin. It decreases incidence and duration of severe oral mucositis. So, yung mga singaw o yung mga nagkakasugat-sugat sa oral cavity dahil ito ay isang keratinocyte growth factor. Again, keratinocytes are the cells of our skin. So, as we grow, as our keratinocytes grow, it produces keratin, and keratin is for toughness, for durability. Ang keratin is an important protein. It's a non-edible protein na component ng ating skin. Kaya yung mga sugat natin sa mucous membrane, which is a cutaneous membrane, which is our skin, na i-improve or nape-prevent kapag nagtitake ng palifermin, which is a keratinocyte growth factor. So again, these drugs are improving the immune system, ini-improve yung natural ability ng immune system para tayo ay labanan yung cancer, and other than that, ina-address yung adverse effects ng chemotherapy drugs, which is bone marrow suppression, also the low RBC, low WBC, low platelet, even yung GI disturbances. But again, as what I've said, sa GI disturbances, especially yung antiemetics, i-discuss natin yan sa gastrointestinal diseases. Okay, that's the end of the chemotherapy drug. Thank you.